Hello, and welcome to the University of Minnesota Medical Center, Fairview, and Amplatz Children's Hospital Transplant Medication Training. The following video has been designed to educate individuals and their caregivers who are preparing for or have recently had a transplant. First things first, I'm sure you may be asking yourself, why do I have to take so many of these medications in the first place? Well, there's a very good answer, and it lies in understanding immunosuppression. Simply put, immunosuppression involves lowering the immune response to prevent rejection of a transplanted organ. Unfortunately, our immune system has a difficult time telling the difference between a virus, bacteria, or a new organ. It doesn't see your new heart, lung, kidney, liver, or pancreas as the life-saving partner it is. That's where the importance of anti-rejection medication comes in. It's critical that immunosuppression be intentionally maintained to prevent your body from rejecting your new organ. I know it may feel overwhelming, which is why I'm going to take you step by step through a post-transplant medication training. We've included medical icons that will appear at the bottom of your screen to guide you to the right personnel for specific questions or concerns. Please pay special attention when you see this symbol. It signifies information we consider critical content and worth noting. Additionally, you'll be hearing from individuals who have gone through the process of organ transplantation and medical representatives. We trust that their stories will provide encouragement and support during your post-surgical journey. Feel free to stop and review this program as many times as necessary, or simply take a break if you need to. You may also want to take a few notes, so I'd suggest having a pencil and paper handy. The more time you spend reviewing this material, the more knowledge you'll gain, and the less difficulty you'll face as you develop your own personal medication routine. Well, are you ready? Let's get started. While in the hospital, medication times are near morning mealtime and bedtime, which is what we recommend you continue after you leave the hospital. Taking medication at mealtimes will help you to remember and may help prevent stomach upset and irritation. Medication containers that allow you to set up several days' worth of pills at a time are strongly encouraged and very helpful. These containers allow you to go back and see if a compartment is empty instead of potentially missing a dose or accidentally taking a double dose. All new transplant patients are sent home from the hospital with a new medication card. This should be shared with all of your primary care and specialty physicians and with your pharmacist. I'd like you to hear how another transplant patient handled their medication organization.
It's very vital that I take my medications at the right times, and I know that I cannot miss a dose of medication because I will be subject to a high percentage of rejection. And I don't want to go back where I came from. That's how come I stick with the medication organizer.
Taking medication is never fun. It's even more difficult when you're not feeling well. However, for those who've had a transplant, skipping your medication is not an option. It takes at least 1 hour for your medications to be adequately absorbed by your body. If you vomit within 1 hour of taking your medications, or if you see your pills come back up, you should take them again. If this happens twice, you may call the emergency answering service. Tell them what type of transplant you've had and that you'd like to speak with the transplant coordinator on call, or go to your nearest emergency room. Your primary physician may write your prescriptions after your discharge, or you can have your pharmacist call the transplant office for a refill approval. Your transplant office will refill only medications related directly to your transplant. However, you must be monitoring lab values as they tell us that you're getting safe amounts of medication and following care recommendations. Be sure to anticipate when you'll need to get your prescriptions refilled, especially if you'll be traveling. We recommend 7 days prior to departure. There are many things to consider when starting your medications. For safety and convenience reasons, it's best to purchase medications from just one pharmacy. Getting to know your pharmacist will aid him or her in maintaining a complete list of all the medications you're taking. Let's listen to another patient's experience.
It's been very important to work with one pharmacy because of the number of pills that I take each day. And working with our post-transplant coordinator in conjunction with the one pharmacy works extremely well. And it makes it much easier for my wife and I to deal with the medications.
Here is a list of some of the medications that should not be taken without the approval of your transplant physician or transplant coordinator. These drugs may interact with your transplant medications and cause serious side effects. Be sure to report any new medications prescribed by any physician to the transplant office. And finally, talk to your transplant coordinator if you plan on becoming pregnant or breastfeeding your child. Herbal and nutritional supplements can pose serious and potentially dangerous problems. It is truly a buyer beware market that may be even more dangerous for a transplant recipient. Many herbal supplements have been shown to increase immune system activity, which can cause rejection. Always check with your transplant coordinator before considering any herbal or nutritional supplement. Many medications are available in two forms, brand name and generic. Your insurance company may require that you take generic medications when available. Do not switch back and forth between different forms of the same medication, as there may be slight differences in the inactive additives or fillers. It's important that you take an active role in making sure you're using the correct medication. If your immunosuppressant medications look different when you get a refill, you need to contact the pharmacy that filled the prescription for clarification and your transplant coordinator. Remember, right drug, right dose, right time. Over-the-counter medications, also known as non-prescription medications, are used to treat minor discomfort, illness, or injury. Read the labels carefully and do not take any over-the-counter medications without consulting your transplant specialty pharmacist and transplant coordinator to clarify directions or warnings. Many common childhood illnesses are treated with over-the-counter medications. Let's hear from a transplant family and learn how they've benefited from working closely with their pharmacist.
One of the things that we as a family, and I think you, Elliot, as a patient, have come to appreciate is that our care team uses the best practices known for transplant patients. And so they are our best source of information first. They do not discourage us from looking to outside sources and bringing that information to the discussion, bringing up new ideas or strategies for Elliot's care. But we really look to them to have the best knowledge for what's necessary for Elliot in particular, not relying on outside information that might not be relevant to his care needs or might actually conflict with what his particular disease process is going on with him. So we really look to them to be the experts, and we work with them as a team rather than us determining what would be the best course of action for care for Elliot.
It's your responsibility to keep all medications out of the reach of children, pets, and the mentally impaired. If you believe someone has been poisoned or taken too much medication, call your nearest poison control center. If you believe you made a major medication error, go to your local emergency room immediately and let your transplant coordinator know. And for your safety, keep important phone numbers near or programmed into your telephone to use in case of such an emergency. To ensure the safety and stability of your medications, storage should be a top priority. Keep out of bright light. Store in a cool, dry place like a linen closet or bedroom. Do not store medication in the bathroom or the kitchen where it's warm and humid, or in the refrigerator unless you're told to do so. For liquid medications, follow storage recommendations on the label. And contact your pharmacist to learn the appropriate method to destroy any medication you're no longer using or has Your insurance representative, social worker, or a financial representative at the University of Minnesota Medical Center Fairview and Amplatz Children's Hospital can be a resource for you if you have questions about payment for your medications. It's important to know whether your insurance company places restrictions on where you can have your prescriptions filled. You'll be meeting or speaking with a representative from the specialty pharmacy to determine if your insurance allows you to fill your discharge medications from the University of Minnesota Medical Center Fairview Discharge Pharmacy. If you do get prescriptions filled at the University of Minnesota Medical Center Fairview and your insurance refuses to pay, you will have to pay for these medications yourself. Now, I know medication is expensive, but skipping them is extremely dangerous. Do not stop taking your medication because of lack of money. If you stop taking your immunosuppression medications or miss several doses, eventually rejection will occur. Instead, call the social work department and they will help you obtain the necessary medications.
If there's one thing that I can remind patients about, it's the importance of always taking their transplant medications. I know sometimes it can be a struggle. But my goal would be if something changes in your life, if something traumatic happens to your health insurance or your ability to pay for your medications, please let people know ahead of time. Please let people know the minute that that happens so that we can explore every resource or every option that we have in the community to help you.
Well, that's it for general information. Next, it's on to the medications themselves. Here we are at a list of the possible medications you'll be taking. Now, no patient will take all of these medications, but it's a good idea to be familiar with them. To better understand post-transplant medications, let's take a look at them one at a time. Neoral is an immunosuppressive medication that helps prevent rejection. Other names for Neoral are CSA or modified cyclosporin. A generic form of Neoral is Gengraph. If your pharmacy makes this switch, notify your transplant coordinator. Gengraph is the only generic form of cyclosporin that is recommended. Neoral comes in both capsules and an oral liquid preparation. If taking capsules, carefully follow the directions on the box for storage and precautions. The capsules can be out of the blister pack for up to 7 days. This means you can use 7-day medication dispenser containers. If you are using the oral liquid preparation, store at room temperature. Measure dose with a syringe. Do not use a styrofoam cup, as it will absorb some of the drug. It may be taken straight or mixed with milk or juice. Stir well and drink all at once. Do not allow the mixture to stand before drinking. Carefully follow directions on the bottle for storage and precautions. Contents should be used within 2 months. Do not mix Neoral in a baby bottle, as it may change your child's feeling toward the bottle, and part of the dose may be missed if the bottle isn't finished.
Take your AM dose in the morning with breakfast and your PM dose 12 hours after the morning dose. Children's doses may be every 8 hours. Do not take your AM dose on lab days until after your Neoral lab level is drawn. Your level should be drawn as close to 12 hours after your PM dose as possible. If you happen to miss a dose, take the missed dose as soon as you remember. Wait 4 to 6 hours before taking another dose. Do not have a Neoral level done within 24 hours of changes in Neoral dose times. If you've forgotten more than one dose, contact your transplant coordinator. You need to take all the amount prescribed to prevent rejection.
The precautions related to Neoral are: do not have grapefruit or grapefruit juice without consulting your nurse or doctor, as they can alter the way this medication is broken down in your body. If you are taking liquid Neoral, do not mix in pineapple or papaya juice. Blood potassium level must be monitored, and other medication which increase the potassium level should be used with caution. Diarrhea and constipation will affect your Neoral blood level. Be sure to report any problems to your transplant coordinator. If you are on dialysis, continue to take your Neoral on a regular schedule. Never take any new medication without telling your transplant coordinator. Possible side effects are flushing, hair growth, mild hand tremors, gum swelling and sensitivity to cold or heat, high blood pressure, elevated serum potassium levels, altered kidney function, altered liver function, yeast infections in your mouth, esophagus, and stomach, nausea, vomiting, diarrhea, rash, and numbness, tingling, burning sensation, sensitivity to cold and/or heat in your hands and feet.
This is a mailer medication. You will receive a letter and a packet of mailing envelopes to take to the lab, where you will get your blood drawn after you return home. The letter tells your lab which specific tests they need to perform to make sure that your immunosuppressant drugs are at a safe level for you. These tests also let us know that your new organ is working well and not in rejection. The mailing envelopes contain more directions for your review.
Prograf is an immunosuppressive medication that helps prevent rejection. Other names for Prograf are FK506 and tacrolimus. Generic forms of Prograf are available. However, please talk to your transplant coordinator or transplant physician before taking. Prograf comes in capsules and can be made in an oral liquid suspension by some pharmacies. If taking the oral liquid suspension, be sure to shake before using. Measure dose with a syringe. Always check the expiration date and storage requirements. Take your AM dose in the morning with breakfast and your PM dose 12 hours after the morning dose. Do not take your AM dose on lab days until after your Prograf level is drawn. Your level should be drawn as close to 12 hours after your PM dose as possible. If you happen to miss a dose, take the missed dose as soon as you remember. Wait 4 to 6 hours before taking another dose. Do not have a Prograf level done within 24 hours of changes in Prograf dose times. If you have forgotten more than one dose, contact your transplant coordinator. You need to take all the amount prescribed to prevent rejection. The precautions related to Prograf are: do not have grapefruit or grapefruit juice without consulting your nurse or doctor, as they can alter the way this medication is broken down in your body. Blood potassium level must be monitored, and other medications which increase the potassium level should be used with caution. Diarrhea and constipation will affect your Prograf blood level. Be sure to report any problems to your transplant coordinator. If you are on dialysis, continue to take your Prograf on a regular schedule. Never take any new medication without telling your transplant coordinator.
Possible side effects are diabetes, mild hand tremors, high blood pressure, elevated serum potassium levels, altered kidney function, nausea, vomiting, diarrhea, decreased appetite, rash, numbness, tingling, burning sensation, sensitivity to cold and/or heat in your hands and feet, and thinning hair. This is a mailer medication. You will receive a letter and a packet of mailing envelopes to take to the lab, where you will get your blood drawn after you return home. The letter tells your lab which specific tests they need to perform to make sure that your immunosuppressant drugs are at a safe level for you. These tests also let us know that your new organ is working well and not in rejection. The mailing envelopes contain more directions for your review.
Cellcept is an immunosuppressive medication that helps prevent rejection. Other names for Cellcept are mycophenolate mofetil, or MMF. Generic forms of Cellcept are available. However, please talk to your transplant coordinator or transplant physician before taking. Cellcept comes in capsules or tablets and in oral liquid suspension. Do not split tablets or open capsules. Caregivers should wash their hands after touching crushed or broken pills. If taking the oral liquid suspension, check the expiration date on the bottle. Women of childbearing age should wear gloves when handling. Caregivers should wash their hands after handling liquid and store at room temperature. Take your AM dose in the morning with breakfast and your PM dose 12 hours after the morning dose. You may be given a smaller dose 4 times a day if you have nausea, vomiting, or diarrhea. When possible, take CellCept 1 to 2 hours apart from magnesium and aluminum-containing products. If you happen to miss a dose, take the missed dose as soon as you remember. If it is time for your next scheduled dose, take 1 dose now, and then wait 4 to 6 hours before taking another dose. If you have forgotten more than 1 dose, contact your transplant coordinator. You need to take all the amount prescribed to prevent rejection.
The precautions related to CellCept are: periodic blood tests are necessary. Report any problems with diarrhea, nausea, or vomiting to your transplant coordinator. Report any infections to your physician. It's very important for women to use 2 forms of birth control when taking this medication, as there is a potential for severe birth defects. Women taking this medication should talk with their physician before planning a pregnancy.
Never take any new medication without telling your transplant coordinator. Possible side effects are nausea, vomiting, diarrhea, and decreased white blood cell count, platelets, and hemoglobin. Myfortic is an immunosuppressive medication that helps prevent rejection. Another name for Myfortic is mycophenolic acid. There are no generic forms of this medication available. Myfortic comes in tablet form. Do not crush these tablets. If you are unable to swallow these tablets, please call your transplant coordinator. Take your AM dose in the morning with breakfast and your PM dose 12 hours after the morning dose. When possible, take Myfortic 1 to 2 hours apart from magnesium and aluminum. If you happen to miss a dose, take the missed dose as soon as you remember. Wait 4 to 6 hours before taking another dose. If you have forgotten more than 1 dose, contact your transplant coordinator. You need to take all the amount prescribed to prevent rejection.
The precautions related to Myfortic are: periodic blood tests are necessary. Report any problems with diarrhea, nausea, or vomiting to your transplant coordinator. Report any infections to your physician. It's very important for women to use 2 forms of birth control when taking this medication, as there's a potential for severe birth defects. Women taking this medication should talk with their physician before planning a pregnancy. And finally, do not take this drug with CellCept.
Possible side effects are nausea, vomiting, diarrhea, and decreased white blood cell count, platelets, and hemoglobin. Rapamune is an immunosuppressive medication that helps prevent rejection. Another name for Rapamune is sirolimus. There are no generic forms of this medication available. Rapamune comes in tablets or oral liquid suspension.
If taking tablets, we recommend using the 1 milligram tablets. If taking the oral liquid suspension, use the 60 milliliter bottle. Closely follow the storage directions listed on the box. The solution should be drawn up with the syringe as directed. Rapamune can be taken straight, followed by water or orange juice. Do not use grapefruit juice at any time. Do not mix Rapamune in a baby bottle, as it may change your child's feelings towards the bottle, and part of the dose may be missed if the bottle isn't finished.
Do not take your AM dose on lab days until after your level is drawn. If you happen to miss a dose, take the missed dose as soon as you remember. If you have forgotten more than 1 dose, contact your transplant coordinator. You need to take all the amount prescribed to prevent rejection. Precautions related to Rapamune are: do not have grapefruit or grapefruit juice without consulting your nurse or doctor, as they can alter the way this medication is broken down in your body. Never take any new medication without telling your transplant coordinator, as some medications significantly change the effectiveness of Rapamune. Blood tests will need to be performed periodically. If you are on dialysis, continue to take your Rapamune on a regular schedule. Use birth control while on Rapamune. Contact your transplant coordinator if you develop a wound that does not heal. Possible side effects are elevated triglycerides and cholesterol, mouth sores, decreased potassium, delayed wound healing, decreased white blood cell and platelet count, elevated blood pressure, rash, muscle pain, and diarrhea.
This is a mailer medication. You will receive a letter and a packet of mailing envelopes to take to the lab, where you will get your blood drawn after you return home. The letter tells your lab which specific tests they need to perform to make sure that your immunosuppressant drugs are at a safe level for you. These tests also let us know that your new organ is working well and not in rejection. The mailing envelopes contain more directions for your review.
Azathioprine is a generic immunosuppressive medication that helps prevent rejection. Other names for azathioprine are Imuran and AZA. Azathioprine comes in tablets and an oral liquid suspension. Be sure to check the expiration date and storage requirements. A suspension for children can be prepared by a pharmacist. Take the entire daily dose at one time in the evening. All of the prescribed amount must be taken to maintain enough immunosuppression to prevent rejection. If you miss a dose, make up the missed dose as soon as you remember. If it is already time for your next scheduled dose, take it and then take another dose the next morning. If you have forgotten more than one dose, contact your transplant coordinator.
Precautions related to azathioprine are: report all symptoms of infection immediately. Take azathioprine after dialysis, not before. Use allopurinol or Xyloprim with extreme caution. It should only be taken under close medical supervision. The combination of these two drugs can cause a serious decrease in your white blood counts, hemoglobin, and platelets. It may be serious enough to require hospitalization and blood transfusions. Talk to your transplant coordinator before you take the first dose of this drug.
Possible side effects are decreased white blood count, skin issues, liver toxicity, hair loss, and allergic reaction. Prednisone is a steroid immunosuppressive medication that helps prevent rejection. Generic prednisone is approved for use by transplant patients. Prednisone comes in tablets and oral liquid suspension. When using the oral liquid suspension, it should be stored at room temperature. Take as directed and with food. For heart, lung, and heart-lung transplant patients, it is usually split into 2 doses, morning and evening. Take your missed dose as soon as you remember. If it is time for your next scheduled dose, you can take a double dose if that combined dose is not greater than 50 milligrams. Otherwise, wait 4 hours between doses. If you have forgotten more than one dose, contact your transplant coordinator.
Prednisone has many side effects, and the side effects are dose-related. The higher the dose of prednisone, or the more times you've been treated for rejection, the more you will experience side effects. As the dose is gradually reduced, side effects diminish. The most common side effects are sodium retention, increased appetite, increased fat deposits, increased stomach acid, mood swings, thrush, increased sweating, increased hair growth, acne, bone and muscle problems, cataracts, blurred vision, diabetes, increased sensitivity to the sun, and increased time for wounds to heal.
Antifungal medications kill the fungus or yeast called Candida. Different forms of medication are used to treat fungal or yeast infections. Possible medication names are clotrimazole troche, Miselex troche, Nilstat, Nilstat swish and swallow, mycostatin, and monostat.
Transplant patients routinely need to take this medication for up to 6 months following transplant, or any time a high dose of steroids is taken. Liquid antifungal medications should be held in the mouth for at least 5 minutes before being swallowed. Troches, lozenge-like medications, need to be taken 3 to 5 times a day, after each meal, in the middle of the afternoon, and before going to bed. They should be held in the mouth for at least 10 minutes, then they may be chewed and swallowed. Don't eat or drink anything for at least 30 minutes after taking these medications. Take your missed dose as soon as you remember.
The precautions with antifungal medications are that they are only effective when in contact with the tissues. If you eat or drink right after taking it, you wash away the medication and its effect. Be sure to brush your teeth 30 to 60 minutes after taking nystatin liquid to prevent teeth from decaying. This is especially important after the dose you take before going to bed. If you wear dentures, remove them before taking this medication. Other antifungal medications should never be started without consulting your transplant coordinator, as they will affect your Neoral, Prograf, or Rapamune blood levels. Valganciclovir is an antiviral medication used to treat and prevent cytomegalovirus, CMV, or Epstein-Barr, EBV. Another name for this medication is Valcyte. Standard course of treatment can last up to 6 months. Pediatric patients may be on medication for 1 year. If you develop rejection, you may need to take this medication again. Valganciclovir comes in tablets and an oral liquid suspension. If taking the tablets, do not break or crush, and caregivers should wash their hands after touching crushed or broken pills. If taking the oral liquid suspension, be sure to check the expiration date on the bottle. Women of childbearing age should wear gloves when handling. Caregivers should wash hands after handling liquid, and this medication should be stored in the refrigerator. This medication is taken 1 time per day and taken with food. If you miss a dose of this medicine, take it as soon as possible. However, if it is almost time for your next dose, skip the missed dose and go back to your regular dosing schedule. Do not double dose.
Safe management of valganciclovir at home is important. This medication is eliminated from the body through urine. Women of childbearing age should wear gloves when exposed to the urine of someone taking this medication. Additionally, women and men must use 2 forms of birth control while taking this medication and for 3 months after it is stopped.
Possible side effects are headache, dizziness, tremor, tingling in hands and feet, vomiting or diarrhea, decreased blood counts, fever, rash, and anemia. Acyclovir is an antiviral medication used to treat cold sores, genital herpes, chickenpox, and shingles. It also helps prevent cytomegalovirus infections. Another name for this medication is Zovirax. A generic form of this medication is available. The standard course of treatment is 6 to 8 weeks. Acyclovir comes in capsules, tablets, and also in an oral liquid preparation. Always check the label for drug concentration information and drink plenty of water while taking.
Acyclovir may be given for the first 3 months after transplant to prevent CMV or to treat infection. Follow your physician's instructions, as acyclovir is used differently for each patient depending upon the type of transplant they've had. If you miss a dose, take it as soon as you remember, unless it is time for your next scheduled dose. Then just take the dose that is due. Do not take a double dose.
Possible side effects are that it may affect white blood cell count, and it may affect BUN and creatinine levels. Gastrointestinal and ulcer prevention medications reduce the amount of acid secreted into your stomach with the intent of limiting irritation caused by other drugs. These medications help prevent stomach upset or heartburn.
Possible medication names are Protonix, Prevacid, Prilosec, Acifex, Nexium, liquid antacid, and Tums. Your dosage may vary depending on the medication you're taking. Oral suspensions are available for children. Most patients benefit from a single dose, but sometimes an evening dose is added. Take these medications according to the instructions from your pharmacy.
Take a missed dose as soon as you remember, then resume your regular schedule. Possible side effects to these medications are headache, nausea, diarrhea, constipation, itching, and rash. SMZ-TMP sulfa, Bactrim, is an antibiotic used to prevent certain types of pneumonia and other infections that can be serious for transplant patients. Possible medication names are cotrimoxazole, Bactrim, Cotrim, Septra, trimethoprim, sulfamethoxazole, and TMP sulfa. These medications come in tablets and an oral liquid suspension. Follow your physician's orders for dosage. These medications are taken in the morning. Take a missed dose as soon as you remember, then resume your regular schedule.
Precautions are, if you don't have a spleen, do not stop taking TMP sulfa unless you're given an alternative antibiotic such as penicillin or erythromycin. Do not adjust your dose of TMP sulfa. Be sure you have adequate fluid intake throughout the day.
Possible side effects to these medications are liver and kidney toxicity, lowered white blood count, allergic reaction with itching, rash, and fever, sensitivity to sun, which will cause you to sunburn easily, and nausea, vomiting, and diarrhea. Acetaminophen or Tylenol is a medication that can be taken as needed to decrease pain from any cause, including arthritis. It also decreases temperature or fever. This medication comes in capsules or tablets and in oral liquids. Follow label instructions for adult and child doses or consult your primary care physician.
This medication can reduce a fever and may cause you to delay seeking important medical care. Be sure to report pain if it continues. Report fevers of greater than 101 degrees Fahrenheit to your primary care physician or the transplant office before taking Tylenol.
Aspirin decreases the ability for platelets to stick together and therefore helps prevent blood clots. It is sometimes prescribed for transplant patients for that purpose. Another name for this medication is acetylsalicylic acid, ASA. Common over-the-counter medications that contain aspirin or a derivative of aspirin are Alka-Seltzer, Anacin, arthritis pain formula, Ascriptin, Aspergum, Bufferin, Ecotrin, Excedrin, and many cold medications. Be sure to check with your pharmacist if you are uncertain about a specific product. Aspirin comes in tablet form. Always take aspirin with a full meal and a full glass of water. Aspirin usually needs to be stopped before biopsies. If you have a biopsy scheduled, talk with your transplant coordinator about your aspirin use. If you miss a dose, take the missed dose as soon as you remember, but not if it is time for your next dose. Do not take a double dose.
Precautions when taking aspirin are to report bruising or blood in your urine or sputum immediately. Do not take aspirin if you're taking Coumadin or another blood thinner unless directed. If you were taking aspirin on a regular basis before your transplant, ask your doctor if you should continue to take it after your transplant.
Possible side effects are ringing in the ears, difficulty hearing, dizziness, stomach upset, stomach pain, burning, or ulcers with bleeding. Cholesterol and lipid-lowering medications help to control blood cholesterol levels, an important part of preventing heart disease. As a transplant recipient, it's important to know that a side effect of some of your transplant medications can be elevated cholesterol. All of the medications listed are approved. Statin-only medications, generic and brand. Combination drugs with statins, generic and brand. Statin medications are more effective when taken at bedtime. If you miss a dose, you do not have to make it up. Instead, just take your usual dose the next night.
Precautions with these medications include reporting any muscle pain or aches to your primary care physician or transplant coordinator. You will need routine liver function tests when taking these medications. Tell your transplant coordinator if you start taking these medications.
Laxatives are foods, compounds, or drugs taken to induce bowel movements or to loosen the stool. It is better to prevent constipation than to treat it. Many laxatives are available in your local drugstore, but some are safer than others for frequent use.
Warning! If you have pain in your stomach, don't use a laxative without talking to your primary care physician first.
The following laxatives are considered safe for chronic use by transplant patients: Bisacodyl Dulcolax, docusate sodium or DSS, Colace Modane Soft, Psyllium, Reguloid, Metamucil, Hydrocel, Modane Bulk. Be sure to mix with a full glass of water. Milk of Magnesia, Senna, Fleet brand enema. Never use enemas without discussing it with your primary care physician. Children can use a pediatric size or half an adult size enema only if discussed with their primary care physician prior to using. Never use an enema when you are experiencing nausea, vomiting, or abdominal cramping. Keep your transplant coordinator informed of the laxatives you use regularly. After you're discharged, it's important to keep the transplant office and your primary care physician informed of all the medications you're taking, including all those you buy without a prescription. You can do this by keeping your medication card up to date and showing it to all members of your healthcare team at every visit. We recommend involving children in the process at an early age so they will learn to be responsible for their medications as they get older. That concludes this portion of your transplant medication training. We've covered a lot of material, and I encourage you to revisit this resource as many times as you'd like. However, before we go, I'd like to share a few very important reminders. Inform your transplant coordinator of any changes in your insurance coverage. Make sure you have your medications refilled before you run out. Take your medications as prescribed. Do not stop taking your medications because of lack of money. Call your transplant coordinator if you need help paying for your medications. There are programs that can help. And please, call your transplant coordinator if you have any questions or concerns. Your transplant team at University of Minnesota Medical Center Fairview and Amplatz Children's Hospital are here to help you.